Systemic Lounge, the space where we, as family therapists, come together to explore topics that matter to us and our practice. Today, we're diving into a crucial topic for every therapist. Ethical dilemmas are something we all face in our work. These dilemmas often arise in situations that aren't black and white, where the right course of action isn't always clear cut. And so in this video, we take an opportunity to look at these dynamics and see each other's perspective. Thank you for watching.
2 weeks ago, we were talking about ethics. We had talked about reaching out to other people, seeing what kinds of ethics information might be of use to people. And yeah, so curious what additional conversations y'all had with folks coming out of 2 weeks ago, and how did 2 weeks ago kind of inform what we might produce moving forward?
Well, I had a few conversations with students. The context is students in internships and practicums and working at sites. And one of the things that I was struck by was their report of the lack of a space where there's reflecting on kind of ethical issues. They're clearly talking about black and white ethical issues, but there's really little space in their report for talking about the gray, which really requires a conversational space where about the issues in an open context. So that was kind of unique. It's very clear they were able to talk about it because they say don't do that. But if there was something ambiguous about it, it was often more difficult. It required a more nuanced conversation, and they were saying didn't have a whole lot of those.
Yeah.
I feel like that's the same thing going on. My interns are graduating from our program this week, and the conversations we've had throughout the year are, what are the ethics? Because I feel like the generation that's coming up has been involved or seen so many different things in society and have these varying opinions, and it's really interesting. Yes, they talk about the black and white, the two very stark ends of the spectrum, but in the middle, they're really having a hard time. Like they're struggling with like ethically, how do I support students or other folks that are protesting in a particular way, or on various topics about when there is a mental health crisis, not feeling like they want to call 911, or like what do we do with these things that are set in place that are kind of like, this is common knowledge. You call this number and this number when this happens. Or even as a trainer, when I train them, and they're like, well, I'm not going to do that. And I'm like, I guess I need to come up with I need to figure out something so then that can be the. But those conversations feel like they're not happening. And I wonder if the ones that are teaching them need to collectively come up with something better, because the generation that's coming up now is not going to do, they're not going to do it. They're figuring out their own remedies to it. And I'm like, I love that. And also we've got to have some kind of uniformity so that we're all on the same page. So where do we start to make those changes instead of just being in this cycle all the time?
Yeah, I think it's even more difficult for people in private practice because I see a lot of my supervisees are mainly in private practice right now. And there are so many gray areas that were never discussed in their course, their ethics course, that we've had to really work through. Like, what are the ethics? What needs to happen? So it's really interesting. I'd like to know more about what are some of the gray areas and how do we deal with them? Like, is there a formula? As you're saying, Portia, like there has to be some continuity. It just can't be random.
All or nothing.
Right. And so, go ahead, Marty. I'm sorry.
I was going to share a different topic. Is that okay? If that's what were you going to say something about what's being talked about?
Is it okay if I tack on to something Jackie was saying?
Yeah, yeah.
Because Jackie, I don't know to what extent you still play a role in the Allied Board. Frank, I know you're a member of the Allied Board. One of the things that y'all talk about is like, what is a practice of ethics? But one of the things that happens is that those conversations, like even though like Brian communicates they're open to the public, like no one comes to those. And so one of the things that I think could be really, really useful in helping to support the work, Frank, that you're doing, Jackie, that you did, is to be able to provide some sort of a platform to talk about, what we were talking about 2 weeks ago. How do we help therapists who might be in similar situations, like think through this, work through this more ethically? That's where, and my idea of using this space to talk about ethics really came from.
As you were talking, one of the things that I'm thinking about is exactly that. Like, what is there any resources around sanctions, or there's another resource for MFT particularly through AMFTRB. So the
Hmm.
Association of Marital and Family Therapy Regulatory Boards. It's a long name. They've done some research across the states for sanctions that have been just sort of received by MFTs through the board. And I thought that was interesting. Yeah, that's one of the things that comes up for me. Like, what are some actual resources that people can, or supervisors particularly, can take a look at and support trainees or interns in sort of having a sense of, oh, these are the problem areas that you might want to look out for in your training.
Right.
I think some of them seem like they were taught, but there's such variations. And I think one of the themes I'm thinking about has to do with working with children of divorced parents. And that is a big one. And
Yep.
what happens is that, in good faith, the therapist wants to do what they feel is best for the child. And in doing that, sometimes they don't look up what the custody, what do you call it, rules were.
Right.
Arrangements, yeah.
Arrangements, yeah. So if, the thing that they need to know is if one parent has custody, that's fine. That's the parent that gives informed consent. But if there are two parents who have custody and one of the parents is estranged, that parent still needs to give their consent. So I think that's a really big one that comes up a lot, don't you think, Frank?
Absolutely. It's always surprising in terms of the frequency, and it's not always MFTs that are sort of dealing with families. And so I know that was a big part of my training to sort of understand that dynamic in terms of custody. It's very fluid, right? You might be dealing with a family that is separating, and the custody agreement changes from the beginning of therapy until that point. And sometimes keeping track of that movement in the family system is tough, especially when you're handling a large caseload, which happens a lot of the time in especially community-based settings.
That's I think is a great example of the. It appears that it's black and white, but it's quite fluid. So the example that you were just given about if you're sharing legal custody and you're estranged, the therapist, my obligation is to reach out to the non-custodial parent and let them know that I'm seeing their kid, invite them to participate. If they don't respond to me, I can still see the child, but I have to demonstrate that I've made an effort to continue to reach out to them. And that's where it often kind of falls, right? It's so gray. You see, well, it's either black or white, but as we've been saying here, it's quite fluid. And we have to be able to have some way of continuing to kind of look at kind of the changing nature of these issues. The other one that I was looking at was, I was just looking up as you were saying that, kind of confidentiality and record keeping, that in private practice, there isn't, particularly where it's a cash-based economy, there is less incentive to keep the same kind of records that you do if you're going to get audited by an insurance company.
Absolutely.
Right. And yet we have the same obligation in private practice. If things go sideways for a client or for the clinician, that's going to be the only record that demonstrates you did all the ethical things that you were supposed to do.
Which becomes especially important in sticky cases like custody cases.
Oh, totally. Absolutely.
Divorce, parental alienation, all
Most
that
important
type of stuff. Yeah.
Yeah. What did the therapist do and why did they do it? What was their thinking?
Right.
In all fairness, I think therapists do it in good faith, that they feel like they're doing the right thing. But sometimes the right thing is unethical and they're not aware of that.
So with good intentions, like you said at the beginning.
Yeah.
Yeah, well, I wonder how hard then that makes, decision making when even the right thing isn't the ethical thing, right?
Right.
Go into this discussion of like, well, what factors define ethics versus what factors define right, and that thought. But I was even thinking, well, are there specific aspects that continue to convolute what ethics once was, right? Was it a lot more black and white, but is the continued, advancement in technology, access to so much, creating kind of the issues that we're seeing with ethics more and more. Like, and I mean, that's just maybe one of many other that is making ethics a little bit more grayer than black and white.
Yeah.
So if I can say, because you're making me think, Phil, like that would be an interesting discussion on the like ethics versus the law. The law is a yes or a no. Ethics are always going to be gray. I mean, they're
Right.
in the middle and whatever. That's what it is. Ethics is a suggestion for. So I don't know what you're thinking, Jackie, when you say the right thing may not be an ethical thing, but what does that mean? Because ethics, it's also always in the best interest of the client clinically. So what could be right but not ethical?
Oh, so
It would be interesting to
yeah, so I'll give you.
I have an example of that too, but
Okay,
Okay.
you go first.
working with custody, working with divorce, like that's a really, really niche thing. There are not a lot of people in the US that have really qualified extended amounts of work, extended amount of research to work with really complicated families, especially when you start getting into like the parental alienation stuff, where there's a parent who's like actively like interfering with the growth and the development of the child. The law says that as a client, you can only work with a therapist in your particular state, who's licensed in your particular state. Well, what if you live in a state that doesn't have people that have expertise in this? Then what do you do? So the law says that you are supposed to kind of stay within kind of your area of expertise, but ethically speaking, like it's important for people to be connected with clinicians with the highest amount of qualification, the highest amount of care, the highest amount of expertise. That's right. So that's an experience, I think, from my perspective, where law and ethics constantly clash.
law and ethics, correct.
And I see this also. Like I have a super niche. Julia and I are, doing work with couples therapy, sex therapy with folks who are leaving religious spaces. There's like 10 of us who do this work nationwide.
Wow.
And we've spent the last year kind of building networks. There's a lot of people who do individual therapy around this. There's like 10 who do couples therapy.
So what you're talking about, I mean, and it's and I know that I don't want to get entangled in concepts, but if we're
Sure.
going to decide to discuss something like this, because it's very interesting, I'm seeing this more kind of something that it's not illegal, maybe ethical, versus something that could be right but not ethical. Because the ethics, it's what's driving us to do the proper clinical work, like you're saying, seeking the best possible care, whatever that means.
Yeah.
But within the law, it doesn't fit the law. And we can find that in almost any area, not just psychology. How many times in life, right? It's like, oh, the law says X, and we're like, but that doesn't make sense because it fits some kind of, I don't know, ruling or whatever, but doesn't take in consideration what we're talking about, all those gray in the middle exceptions and needs to do. So I find very interesting. I think like what people have posed is kind of like that. How does one balance, right? Like in doing the ethical thing versus the legal. I mean, we are bound by the laws, and the ethical is more of a discussion, or it has more flexibility.
Yeah. So Phil, I think that the two questions that you asked earlier, I think are really important
Exactly.
for us to be able to ask in any sort of situation. What does the law say about this? What are some of the ethical issues that come up? What are the potential clashes that might happen? And how do we want to navigate these clashes? And then getting back, Frank, to what you're talking about, and David, what you're talking about, like how do we document that? So that in a worst case scenario, if we get brought to the board, that we're able to like lay out our case about, hey, this is the reason that I made this particular decision. This is the double bind that I was in.
As I was listening to some of these conversations, I'm thinking about myself really when I started to work in community-based setting, and it felt as if I was learning some of these nuances as I went. And I've been part of initiatives to support clinician burnout in a community-based setting. It seems like at the 6-month mark, there's burnout that is sort of the cause for these clinicians who started and have all this energy to start working with clients to consider not just going away, but it's almost, is this even right for me? Not just going away from that agency or community-based setting, but is this something that I'm equipped to be able to do in light of all these stresses? And I'm curious if these sort of nuances that keep sort of popping up for a person that doesn't know much is allowing for that burnout to sort of develop or exist.
You know, you were saying you were thinking about yourself, and I was like, that sounds familiar too.
Exactly.
So like, and I think about like, you know, a lot of those situations, it goes back to this idea of like what is taught ethics versus how do you learn to be ethical. Like that, and I feel like there's less time spent on this aspect of like how do we learn to be ethical, which also takes a whole lot of like saying that's work, right?
Right.
That's mental and emotional like decision making and critical thinking that needs to go into that. And I that's where I think even I'll say like I felt a little bit unprepared for, right? Like I was not ready for my like I thought like everything's black and white. And I think that has to maybe be part of the new conversation around ethics is we can teach you all this black and white stuff, and let's teach you also how to make decisions, because if you're unaware, it can take a lot of your time and energy.
Phil,
Yeah.
just as a response to what you said, I'm curious who's responsible for that development, because it seems to me like you're saying teaching as if this is something that the school is responsible for, but without the experience, it's kind of hard to teach those nuances. So I'm
That's
curious.
right.
Well, I have a thought about that.
Right.
That I'd worked in an agency where I was a director of training, and they did a lot of work on why people left, the very thing that Frank was talking about, burnout. And so we flipped that around. Instead of asking why people left, we asked why have you stayed. And what we found, number one thing, because my supervisor supports me. My supervisor creates the space for me to talk about issues. I feel heard. I feel appreciated. I feel valued for my ideas. So if there isn't that space, then the therapist is going to get burnt out because they keep getting burdened with challenging cases that they're unprepared for without support.
Absolutely. That's what we found as well. And is there space to explore, like just to respond to Phil's point, like, there's something, it's not just about this black and white, but how am I incorporating my sense of ethics into my work? And that development, I think it can happen through supervision. But what's my sense of self and where's my voice in being able to mitigate this sort of complicated situations?
I was going to say something before you, but you kind of said it, is that it's also the type of supervision you get.
Sure.
Absolutely.
So if you get a supervisor who tells you what to do, it goes back to what you said, Phil, you're never going to develop your own sense. But if you get a supervisor who is able to ask a powerful question of how you are going to solve this and help them come to a decision on their own, then they start developing a way of knowing.
Yeah.
So I think that, when we talk about ethics, maybe we also have to talk about supervision.
Sure.
I really like that, Jackie, because I think fundamentally it goes to the idea again of like how do we teach critical thinking, right?
That's right.
And in addition to what you're saying is that they may be aspects of yourself, right, that come into that critical thinking. And the first thing that for me that comes up is like just cultural competency outside of just learning, also like what you experience yourself. So I really like that because it kind of blends those two and hopefully answers
The domino effect of thinking, how it trickles down generations of professionals, or
I was even thinking the other aspect real quick is like, well, what if also the people who are making decisions on what's ethics, what is ethical, what's not ethical, are also getting the own education in what are the things that are complicating ethics, right, for lack of a better term, and then working with that new generation way or other to figure out ways around it. Not just a thought.
Yeah. Portia, what were you going to say?
I think there's also some privilege behind ethics because if you're in private practice, you have way more flexibility to do what you want to do for the most part. I mean, especially if you're basing your ethics off of not causing harm. If you're doing anything outside of causing harm, then you get to kind of slide a lot of things across the table. And especially in Massachusetts, with there being community mental health, like that's a large part of people's careers when they start off. And as you kind of move through those things, especially because it's usually mass health, they have very strict rules. There's really no in between, unfortunately. but there's so much in between. There's so many things involved that happen. And I know I speak about this a lot because I'm really passionate about the other like positions like therapeutic mentoring and therapeutic training and support. When you're in the field and working in those spaces and trying to figure out ethics, it is really, really hard. Like when my internship and practicum, or even as I supervise those positions now, I don't feel like there's been much different, especially because a lot of the workers that are TM and TTNS are working in their communities. They see these youth.
That's right.
They could be one person removed from being related to them. And we don't have solid ethics that protects the staff, protects the family. I think we have to do better. We really do, especially because we have such a broad form of treatment with CBHI. That's just something I'm really, really, really passionate about. And I'm like, what do? We have some great foundational things. We've got to go and fix the cracks in the foundation. We have to.
So look like when a clinician, goes to Fridays with his family, and he's with a hoodie, and a client just passes by, and hey, yo, Frank.
Yes, exactly. That dual relationship idea that Phil was talking about at the onset, the beginning of psychotherapy was keep your relationships kind of separate. But if you live in the same town, the same community, you're the only therapist. You belong to the same church, the same
That's
gym.
right.
Yeah,
That's right.
And we push for with therapeutic mentors. We love therapeutic mentors to come work at the community mental health place that they are. Actually, that's how I met Frank. I was an intern, and Frank was in. Were you a TM or TTM?
I was both. I was doing both.
Yes. And so I was following for both of those roles. And I just remember thinking, like, wait a minute. So everybody just knows each other. Oh, I see them on the weekend. So how do we go in their house and help them and tell them what to do? And it was a lot in telling our age, but like a decade plus later, it's the same issue. The issue has not changed at all. My staff still have this same problem today. And we're playing Tetris with clients because it's like, no, actually, I go to church with them and they see me at Bible school on Sunday, so I can't be their TM and their Bible school teacher. And I'm like, oh no. So it has to change. We can't stay in this place.
That's right.
Yeah, Portia, you brought up an issue around privilege. The Code of Ethics originally was written by white men.
Like anything else.
In an era when things were more black and white, and that basically there was some community mental health, but there were lots of people in hospitals and working in hospitals. It was there were different settings. There weren't the variety of settings that we're talking about now. And so those code of ethics were great for that time, possibly, but times have changed so drastically. And, like you were saying, Frank, like you might work with gang members or you might see them outside and you have a connection with them.
Right.
So how do you deal with those things? And I'm just using that as an example, but things have changed so drastically and have the schools and their course caught up with what's going on now.
Yep. Just wanted to be aware of time here. It's 1:15. Maybe we take the next 2 or 3 minutes to wrap this conversation up. Think about where we might go from here. And then I'm happy to keep the recording going, but just for the sake of kind of creating some structure here, let's talk a little bit more about the Instagram, and let's talk maybe more about next steps and what we can do with this.
I think it goes with what you were saying about the dual, like seeing each other. I've been very much in communities, and it may be too specific, but I'm actually even I wrote a proposal for the Latinx Psychological Association on touch and therapeutic touch and the controversy of zero touch and especially and how therapeutic and that in the ethics there's no place that says don't touch. It says no cross boundaries, and boundaries are very much defined culturally.
Yeah.
And in the United States, culture is about no touch. This is a different. So I wonder if at some point we can introduce that too. Kind of like there's nothing that says no gifts. We have defined that because in some place, I don't know, maybe in the jail, in the whatever. I mean, there are places, of course, that it's not appropriate, the touch or the gift or things like that. But How do we deal with things like that when actually we have gone through so much to the other time in terms of so much to the other side that we don't exploit the benefits of that warmth and therapeutic. So anyway, just wanted to throw it out there.
Yeah.
But aren't there comments?
The question we can propose to people is, have you thought about how to resolve this issue? And what kind of grand thing can we do by collecting all this data, petitioning and collecting data, putting it together and creating a proposal for an updated ethics guideline and boundary that matches the good year of 2024 and what we're experiencing now, because the previous book is not helpful. It's not
That's right.
helpful. Even the face of therapy has changed for the simple
That's
fact
right.
that we have more providers of color and more people of color coming into therapy. Honestly,
Right.
it makes it hard for therapists of color to be like, oh, how do I protect my license, but also fall into these cultural bounds that are going to come in the room, period.
That's right. And as I said last week, and I want to like continue to bring up, like there's a fine line. At what point do ethical violations? At what point are those really clashes in cultures?
And actually causing harm.
That's right.
Yeah,
Because
that's
we're
correct,
doing
Portia.
it well.
Yep.
I know that I mentioned this before, but one of the things that I always think about it, who are the stakeholders in sort of upholding responsibility for this moving in this direction? We all see the benefits of being like a culturally aware and responsive in sort of allowing space for a student to learn what their ethics, sort of their ethical identity in this sort of conversation is something that I've been thinking about, like
Yeah.
who's responsible for that, and as we're talking about this, look, the LMHC license is changing, and there's a structure that came up a bit ago in that the supervisors have more language in terms of who's qualified to support in supervision for LMHCs, while the sort of the language and the laws have not been published yet. That's something that's been in the works. Something like that is particularly important because the language in supervision has changed to allow for specific what does clinical supervision look like for a new therapist. And I think that that's important to sort of think about as LMFTs, because we don't have that specific language yet, and movement in that direction can support ideas like this.
That's right.
That's a great distinction.
yeah, great.